Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Hi, everybody. This is Dr. Brian Jackson here with Healing Families Shattered by Addiction. Thank you for listening in. I am solo today. I'm actually out in California, and Di is in Florida. Came out here to visit the grandkids, so it's been a lot of fun, and it's always great to see innocence, with the young ones. But in any event, for those of you that are listening that, may have an issue with alcohol and or drugs, I wanted to talk about something that I think is very important is that we understand is that there are 7 different types of drugs that in terms of categories. And basically, what the key takeaways are from that, and maybe get into, some specifics in terms of specific drugs and what the risks are that are associated with that. So some of this stuff is prescribed and necessary. And in other cases, these things may be abused, whether you get them from a friend or off the street, or you're prescribed them and you take more than is prescribed for you. So, we hear a lot about opioids, and opioids relieve pain, but they pose a very high addiction risk. So for those of you who've been in the hospital or been to the doctor with a lot of pain, they usually don't prescribe you a lot of medication because it is very, very addictive. There's also depressants, which induce relaxation, but they have sedative dangers associated with that. If you take too much, you can have, auto-respiratory failure, dizziness, things of that nature. Another one is hallucinogens, excuse me, which can cause altered perception and other risks. In other words, you could have auditory and visual hallucinations associated with that. And then there's dissociatives, which lead to detachment and potential harm. And I'll get into what some of those dissociatives are as we go through this quote unquote educational, if you will, podcasts. Inhalants are another of concern, and some people shake their heads and say, really? People do this? But it offers a quick high with various health risks, and that's snorting or inhaling things that you normally wouldn't think that people would do. And then, of course, there's cannabis. And, a lot of people don't realize that it can act as a psychoactive medication, but it can have some medicinal benefits. I've seen that for people who get it prescribed by a doctor, typically for pain and or sleep disorders, maybe sometimes anxiety. But there's also the potential for abuse with cannabis. So there are 7 different types of drugs, and pharmacologists categorize them based on how they affect the body. So everybody's wired differently. Some drugs slow down the bodily functions, while others speed them up. I've had clients who smoke cannabis, and it makes them to where they can't get off the couch, and very hungry for snacks and stuff. And I've seen other people where cannabis actually gives them energy, and they run around cleaning up the house and things of that nature. So again, everybody is wired differently, and drugs have different effects on different people. So each type of drug has its own set of characteristics and risks. And additionally, each of these drugs can be dangerous and highly addictive. So here are the types of drugs and what they do. So stimulants, they increase activity in the central nervous system, resulting in increased heart rate, blood pressure, and alertness. So it really speeds up everything that's going on in your body. The opioids we talked about, they're powerful painkillers that provide a sense of euphoria, reduce pain, and cause drowsiness. So I think the euphoria associated with it is the risk um, that leads to people, using and abusing opioids. So, but it's typically used to treat people experiencing severe pain. So they do have a function. I mean, obviously, if you're in an operation or you were in a car accident, God forbid, they do serve a function if you are in true severe pain. Um, and then there's depressants, and they affect the central nervous system and slow it down as opposed to the stimulants, which speed it up. So this can cause people to feel relaxed and, is prescribed for anxiety or insomnia. The hallucinogens really disrupt the brain activity and sensory perceptions, so resulting in hallucinations. And I think I alluded to that early on, which can come in the form of visual or auditory hallucinations. Um, Dissociatives, and we'll talk about what some of those are. They also interfere with the brain's receptors for glutamate, a chemical responsible for cognition and emotionality, and that can result in an out-of-body experience. Um, Inhalants, they're a volatile substance that produce chemical vapors. These vapors can cause a feeling of euphoria or mind-altering effects. And unfortunately, with the inhalants, it's almost like a brain fire and can do permanent damage to the brain. And then we talked about cannabis, commonly known as marijuana. So again, cannabis can have a hallucinogenic and depressed like effects, but there's some people where it speeds them up. But so let me give you some examples of different drug types. And not all of these drugs are illicit. Some can be purchased over the counter or prescribed by a doctor. And in some case, they've even found in common household products. So we talked about stimulants. So let me give you some examples of stimulants. Some of these you've heard of, and some of these you may not have heard of. And so when you have a loved one or yourself prescribe some of these medications, we just want to be on the lookout for the risks associated with it. So some examples of stimulants would be Adderall, Ritalin, synthetic marijuana, cocaine, methamphetamines, ecstasy, and caffeine, believe it or not. So the risks associated with the stimulants is that it can cause anxiety, paranoia, psychosis in some cases, high body temperature, fever, depression, heart failure, stroke, and seizures. So, we got to be very, very careful with these medications, these stimulants, especially if we're using them recreationally. We don't realize the potential risks that are associated with them. Opioids, the one that we're really having a crisis with right now throughout the United States and the world, is in the form of heroin, morphine, hydrocodone, opium, Norco, Oxycontin, Percocet, and codeine. And the risks associated with those are nausea, vomiting, diarrhea, anxiety, inability to sleep, hot and cold flashes, excessive sweating, muscle cramps, runny nose, and watery eyes. I've had other people report to me that they've had restless legs. So really the euphoria associated with is really not worth the risk, of these really, really uncomfortable things. It's almost like having the flu ×3, especially when you're trying to come off these opioids. Different depressants are barbiturates like phenobarbital, but also widely prescribed as anti-anxiety medication. which we call benzodiazepines, and typically that's in the form of Xanax or Valium. And then, of course, alcohol is a central nervous system depressant. So these depressants, can cause confusion, dizziness, extreme sleepiness, slowed heart rate, difficulty speaking. We've seen that where people have had too much to drink, inability to concentrate, lack of coordination, and labored or shallow breathing and death. So when I talk about auto-respiratory failure, the combination that's really dangerous that we see is alcohol in combination with some sort of benzodiazepine, i.e. Xanax or Valium. So two central nervous system depressants together is very dangerous. And then let's talk about hallucinogens. Really popular more with the younger population, if you will, would be, hallucinogenic mushrooms, mescaline, and LSD. So hallucinogens, persistently cause, perception disorder, fear, distorted cognition, paranoia is very, very common, psychosis, anxiety, increased blood pressure, and nausea. So, yeah, not very good. Is the risk, worth the temporary reward of euphoria associated with this? And it certainly doesn't sound like it to me. But a lot of times people don't think it through. But if you have a loved one that's doing these things, you certainly can be aware of the potential consequences and risks associated with it, which leads us to disassociatives. You hear a lot about ketamine. DXM, believe it or not, it's actually cough medicine. And we've seen a lot of this lately where people are drinking Delsum to get the effect, which is a hallucinogenic effect, if you will. But these disassociatives can cause, and the thing about it is it's easy to get because they sell it over the counter. And I've seen people have psychotic breaks as a result of using DXM, in the form of, some of these brand name cough medicines. But it can cause depression, anxiety, suicidal thoughts, speech difficulties. You withdraw socially. Hallucinations are very, very common when using these. And then the detachment from reality, numbness, and memory loss. And I've seen a lot of people end up in the hospital, in the psychiatric unit with, having a psychotic break as a result of using those. And the next one, which might sound bizarre to a lot of people, is inhalants, where people smell like markers, like a magic marker, paint thinner, gasoline, believe it or not, glue fumes, nitrous oxide, aerosol sprays, and room deodorizers. So the risks associated with that is loss of smell, brain damage. And a lot of times that brain damage, as I said earlier, is permanent. You could have nosebleeds, weakness in your body, euphoria, increased heart rate, loss of consciousness, hallucinations, and slurred speech. Again, the risks just, I don't think are worth, the temporary euphoria that you do get from using inhalants or any of these medications or drugs. And then finally, cannabis, and that comes in the form of marijuana leaves. There's hashish, hash oil, and cannabis-based, medicines like sativa is one of them. So you have a lowered immunity to illness, depression, chronic anxiety, reduced sperm count. Yeah, it does affect the reproductive system. Sedation, slowed reaction times, enhanced senses like seeing brighter colors or something like that, and an impaired sense of time. So I really wanted to go through this because I don't know that we really touch on it in terms of the effects and risks associated with the use of these 7 types of drugs. And I think it's very important for the person who may be experimenting with these things, but also for family members who are aware of loved ones who may be indulging in these type of things. But So I just wanted to get that out there, just kind of give us an education. And it's always a good reminder to me that, there are some things that we don't realize that can cause us to be susceptible to death. Uh, and addiction is, a chronic progressive disease that, typically ends up in jails, institutions, or death. So for those of you out there that are wanting help, please reach out and we will direct you to who we think is appropriate for you. You can send us any queries or questions to info@familyandaddictionexperts.com. Please go on our website. We have a family survival kit on there, and there are PDF files that you can download for free to give yourself an education on everything from boundaries to enabling to the effects of drugs on the family, things that you can do to set boundaries, on and on. But again, thank you for listening today. I hope this wasn't too boring, but I think it's important that we know what these 7 types of drugs are, drug classes, and specifically what they are and the risks associated with them. So hopefully I will be on with Di next time. I miss seeing her. And we will have another podcast for you. So thank you so much. I appreciate your listening. Thank you. Bye-bye.
Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.